Former All Blacks legend Keven Mealamu was a tough man on the field. Off the field, he's encouraging men to be tough on their physical well-being during Men's Health Month in June. The campaign run by Men's Health Trust New Zealand aims to raise awareness of preventable health problems and encourages early detection and treatment. On average, one man in Aotearoa dies every 3 hours of a preventable illness, with death rates for Māori men double that of non-Māori. Keven joins us now to talk about that. E te rangatira, Keven, ngā mihi nui kia koe. Welcome to the program. Let's begin with why, with the statistics that are really high for men, right? So have you had men in your whānau or close mates pass because of preventable diseases?
I think, firstly, kia ora and ta alofa lava. Thank you for having me today. Yes, I think when we look across not only our family, we can see it across our close friends as well. And sometimes I think, it's probably personal for me, but when you think about it, sometimes our relationship with going to see a doctor hasn't always been on, it's always when it's come across death. So when we think about why we go to see a doctor, it's usually the mindset, or what it usually has been in the past is it hasn't been for a good thing. So I think what it starts with really, or where it's going to start with for us as well, is just how do we change the relationship, or how do we change the narrative around why we go to see a doctor.
That's an interesting... Absolutely, because I mean there are obviously a lot of reasons why the rates for Māori and Pasifika men are quite high, right? So what are there other reasons that are preventing men to go and see the doctor to get checked out early?
I think when you think about Pacific Island and Māori men as well, like being the providers, often your time is spent looking after or doing things for other people, and the person that you forget about is you, being able to put some time into yourself. So I think it's something that we need to, especially for our men, they're strong and proud men as well, and being able to put some time into looking after ourselves means we can do what we love to do even longer.
Absolutely.
And it's probably something that we don't spend enough time, which is a bit of self-care.
Yeah. Is there a level of fear as well, do you think?
Big time. Yes, I think big time. I think fear is a big part of hearing something you don't want to hear as well. So you probably hit the nail on the head with the last 3 points, especially being that fear is something, that having discussions with doctors and having discussions with people and hearing something that you're not expecting to hear or you don't want to hear, they're often barriers for us not having those conversations.
So you're involved in the CheckMates program. What is that? Can you explain what that is?
Well, our CheckMates PI program just gives the opportunity for our Mori and Pacific Island men to help transform their lives. So being able to not only set up a place for them to feel comfortable and to have these conversations, but also look at ways of doing self-care, because we can put that word out there, but if you don't know what it is and how to do that, it becomes a real challenge or a chore. So being able to get some right people in to help our men do that and feel comfortable, and that's being able to create a space where men feel safe and feel comfortable doing that.
That's fantastic. So what activities are happening to encourage men to get checked and to obviously look after their health?
Well, I think it's I think what's going to start first is first being able to get the men together. So in order for us to have the conversations, like we said before, it's hard to jump into the deep end and say, just go get checked, right? Yeah. So it's about building those relationships first. And then how is it that we start building enough trust and build relationships that we find people that our men feel comfortable with, that we can start having these conversations. Because I think that's the best and the safest way to start before jumping in the deep end and saying, okay, now that we've built these relationships and we're with people that we trust, let's start getting our checks done.
That sounds excellent. Keven Mealamu, thank you very much for taking time out to speak to us today and on this very important kaupapa. Ngā mihi nui kia koe, tēnā koe.
Thank you.